Achilles tendon rupture is another common presentation in the foot and ankle practice. Usually there is a prodrome of symptoms. A prodrome is a scenario of some type of pain or discomfort in the involved anatomic location that then leads to an acute injury. So as in the example of Achilles tendonitis, which is a common presentation to foot and ankle surgeons, oftentimes with an Achilles tendon rupture, when we ask questions and obtain the history, the patient will say that they have had some type of issue or pain with the Achilles tendon, although not debilitating, for some period of time. And then the classic example is the weekend warrior type of athlete that decides to play in a pickup game of basketball or maybe the men's league basketball, and there is an abrupt ballistic movement, a quick movement in one direction or another, or an abrupt change of direction that puts an increased load on the Achilles tendon, and because of the underlying pathology which existed for weeks or months prior, the Achilles tendon then gives way, which we call a rupture. This is often something that requires surgical repair, although non-operative management is an option for some patients depending on activity and demand level. Typically for the elderly individual, we may consider non-operative management. Surgical intervention is the gold standard. We do a primary imbrication or repair of the Achilles tendon. Oftentimes I will augment that repair with graft material, which gives immediate inherent stability to the repair. It also diminishes risk of re-rupture, which is a concern with standard imbrication or repair of the Achilles tendon. The recovery process can be quite lengthy. However, with the graft augmentation, that process is sped up. This is typically a 6-month to 1-year full recovery. Return to activity, return to sport is dependent upon the athlete and the sport. However, for full ballistic movements and full strength, this is anywhere between 4 and 6 months for the elite athlete, and sometimes up to a year in some athletes depending on the sport.